It is 2 in the morning. You are alone in your house. Suddenly, you wake up with a strange, heavy pressure in the center of your chest. It feels like an elephant is sitting on you. You try to take a deep breath, but you can't. Your first instinct is panic. Your second instinct is to go to the kitchen and drink a glass of water to calm down. I need you to listen to me very carefully. That glass of water could be the mistake that ends your life. We are often told that water is life, but in the middle of a cardiac event, swallowing liquid can trigger a chain reaction that blocks your medication, floods your lungs, and wastes precious seconds. Most seniors over 60 who die from heart attacks do not die in the hospital. They die in their living rooms. They die because they do not know what to do in the first 10 minutes. They hesitate, they try to sleep it off, or they follow outdated advice. Today, I am going to teach you the Alone Protocol. I will explain the biological reason why chewing a specific type of pill is 10 times more effective than swallowing it. I will show you the exact body position that keeps your heart pumping when gravity is working against you. And I will tell you why you must never, ever lie flat on the floor. But first, we need to identify the enemy, because in real life, a heart attack rarely looks like what you see in the movies. This brings us to point number 1, the Hollywood myth versus senior reality. On television, the actor clutches his left arm, screams in pain, and collapses instantly. That is dramatic, but for seniors, it is deceptive. As we age, our nerve endings become less sensitive. This means you might not feel pain at all. You might feel discomfort. For many seniors, especially women and those with diabetes, the signs are silent and subtle. It might start as a sudden wave of nausea. It might be a dull ache in your jaw or your neck. It might feel like bad indigestion that simply won't go away with antacids. Or it might be a sudden cold sweat when you haven't been exercising. And most terrifying of all is the psychological symptom known as the sense of impending doom. It is a sudden, overwhelming feeling that something is terribly wrong, even if nothing hurts. If your body whispers these secrets to you, do not ignore them. Treat them as a code red. Why is speed so critical? That is point number 2. Time is muscle. Your heart is a pump made of living tissue. It needs oxygen constantly. A heart attack is simply a plumbing problem. A clot blocks a pipe. The blood stops flowing. The second that blood flow stops, a clock starts ticking. In the first 20 minutes, the heart cells are stunned. They stop contracting, but they are still alive. This is your window of opportunity. But after 20 minutes, if that blood flow is not restored, the cells begin to die. They burst. And once heart muscle dies, it never grows back. It becomes scar tissue. A heart with too much scar tissue becomes a weak pump, leading to chronic heart failure. Every minute you spend wondering, is this just gas, or I don't want to wake up the neighbors, is a minute where millions of heart cells are dying permanently. You must act fast. But acting fast does not mean acting recklessly. This leads us to the most common instinct and the most dangerous error. Point number 3, the water trap. When the heart is in distress, the body activates the vagus nerve. This can cause sudden nausea and, paradoxically, intense thirst. You will feel a dry mouth. You will want to drink. Do not do it. There are 2 medical reasons for this. First, simply swallowing creates a risk of aspiration. If you pass out or if you vomit, which is common during a heart attack, that water in your stomach can come up and go into your lungs. You can drown in your own fluids. Second, and more importantly, water dilutes the acid in your stomach. We are about to discuss the single most important pill you can take to save your life. For that pill to work, we want it to absorb instantly. We do not want it swimming in a pint of water. So, rule number 1 of the protocol: keep your mouth empty. No water, no food, no tea to calm the nerves. Now that we've stopped the bad habits, let's introduce the life-saving chemistry. Now, let's talk about the single most effective chemical intervention you can make at home. Point number 5, the aspirin rule. Specifically, chewing versus swallowing. You might think, I take an aspirin every morning with water. I am safe. No, that is maintenance. We are talking about emergency triage. Here is the science. A heart attack is caused by a clot. Your blood platelets have become sticky. They are clumping together like bricks building a wall, blocking the artery. Aspirin is an antiplatelet agent. It makes your blood slippery. It stops the platelets from sticking. It stops the wall from getting higher. It does not dissolve the clot, but it stops it from growing. This keeps a tiny trickle of blood flowing, and that trickle is life. But here is the catch. If you swallow a pill whole, it goes into your stomach. It has to dissolve, it has to pass into the small intestine, it has to be processed by the liver. This takes 20 to 30 minutes. You do not have 20 minutes. When you chew the aspirin, you crush it into a powder. It mixes with your saliva. It is absorbed directly through the mucous membranes in your mouth and under your tongue. It enters your bloodstream in as little as 5 minutes. Chewing is the difference between a fast-lane superhighway and a traffic jam. This brings us to point number 6, the specific dosage. Go to your medicine cabinet today and check what you have. You are looking for regular, uncoated aspirin. If you have baby aspirin, which is usually 81 milligrams, you need to chew 4 of them. 1, 2, 3, 4. That equals 324 milligrams. If you have a standard adult aspirin, which is 325 milligrams, chew 1 full tablet. And please listen to this warning. Do not take Tylenol, acetaminophen, or ibuprofen like Advil. They do not have the same anti-clotting effect on platelets. In fact, some studies suggest NSAIDs like ibuprofen can actually interfere with blood thinners or increase risks during an attack. Stick to aspirin. If your aspirin has an enteric coating or a safety shell, chew it anyway. Crunch through the shell. It will taste bitter. It will taste terrible. Do not worry about the taste. Worry about the time. So, you have called 911. You have chewed your aspirin. Now you feel dizzy. You feel weak. The room is spinning. Your instinct tells you to lie down on the carpet and close your eyes. Do not do it. This is point number 7, the gravity trap. It seems logical to rest, but lying flat on your back increases what doctors call venous return. Gravity pushes all the blood from your legs and your stomach back toward your heart. Normally, this is good, but right now, your heart is damaged. It is a broken pump. It cannot handle a flood of blood. If you lie flat, you flood the engine. The blood backs up. Where does it go? It backs up into your lungs. Fluid leaks into the air sacs. This is called pulmonary edema. Essentially, you begin to drown in your own body fluids. You will start coughing up pink froth and you will suffocate. You must fight the urge to lie flat. You need to use gravity to help your heart, not hurt it. There is a specific position used by paramedics globally that maximizes your lung capacity and reduces the workload on the heart. So, if you cannot lie down, what should you do? You must assume the W position. Here is exactly how to do it. Sit on the floor. Lean your back against a wall. or the base of the sofa. Support your head and shoulders. Now, bend your knees up towards your chest. Your feet should be flat on the floor. If you look at yourself from the side, your body forms the shape of a W. Why is this specific geometry so powerful? First, by keeping your torso upright, gravity pulls fluid down towards your legs, keeping your lungs dry. Second, by bending your knees, you take the tension off your abdominal muscles and your diaphragm. This allows your lungs to expand fully with less effort. You get more oxygen for less work. And third, it is a safety net. If you lose consciousness while standing or sitting in a high chair, you will fall. You could crack your skull. On the floor, you are already grounded. You are safe. Now, let's address the most controversial technique on the internet. You may have seen viral emails about cough CPR. They say you should cough rhythmically to survive a heart attack. Is it true, or is it a myth? The answer is, it depends. If you are conscious, alert, and simply in pain, sitting quietly and breathing slowly is better. Coughing raises your blood pressure and heart rate, which we want to avoid. However, there is a specific moment where coughing becomes a weapon. It is the moment the lights start to go out. If you suddenly feel profound dizziness, if your vision starts to turn into a tunnel, if you feel like you are about to faint, this usually means your heart has stopped pumping effectively. It has gone into an arrhythmia called ventricular fibrillation. You have about 10 seconds before you pass out. In this specific window, cough. Take a deep breath and cough hard. Deep breath, cough hard. Do it every 2 seconds. The physics is simple. When you cough forcefully, you create a massive spike of pressure inside your chest cavity. This pressure squeezes the heart manually. It forces blood out of the heart and up to the brain. Essentially, you are performing CPR on yourself from the inside out. It can buy you 30 seconds of consciousness, and those 30 seconds might be just enough time for the sirens to arrive. But the sirens are useless if the paramedics cannot get to you. This brings us to point number 9, the fortress trap. We are programmed to lock our doors for safety, but in a medical emergency, a locked door is a barrier. Firefighters have access, they have rams, they can break down your door, but that takes 3 to 5 minutes. Remember, time is muscle. Do not make them break the door. Before you sit in the W position, before you lose your strength, go to the front door, unlock it, crack it open slightly if you can, turn on the porch light, make yourself visible. Then, and only then, do you sit down. You have unlocked the door, you have chewed the aspirin, you are in the W position. Now you are holding your phone. What you say to the operator and how you say it is the final link in the chain. Point number 10 is the phone strategy. You are on the floor. You have dialed 911. Do not hold the phone to your ear. If you faint, your hand will relax and the phone will slide across the room. The operator will be shouting, "Hello? Hello?" But you will be too far away to answer. They won't know if you are there. Put the phone on speaker mode. Place it on the floor right next to your head. And when you speak, do not be polite. Do not say, "I don't feel well." Say 3 specific words: suspected, heart, attack. These words trigger a Category 1 response. It tells the dispatcher to send the unit with the defibrillator and the advanced cardiac life support gear. If you just say chest pain, you might get a standard ambulance. Be specific. Now, a special warning for the ladies watching. Point number 11, the female disguise. Everything I just told you applies to women except the pain. For many women over 60, the elephant on the chest never arrives. Instead, women often feel a sharp pain between the shoulder blades. It feels like a pulled muscle in the back. Or they feel extreme, unexplained fatigue, like they just ran a marathon, but they haven't moved. Many women mistake a massive heart attack for the flu or acid reflux. They take an antacid and they go to bed to sleep it off. This is the tragedy. If you have sudden back pain combined with nausea or sweat, do not sleep. Call. And finally, point number 12, controlling the internal storm. You have done everything right. Now you must conquer the hardest enemy of all, fear. When you are terrified, your body floods with adrenaline. Adrenaline is a stimulant. It makes your heart beat faster. It raises your blood pressure. It demands more oxygen. But your heart is starving for oxygen. Adrenaline is like throwing gasoline on a fire. You must chemically lower your adrenaline. You do this with tactical breathing. Close your eyes, inhale through your nose for a count of 4, hold for 4, exhale for 4. This rhythm hacks your vagus nerve. It forces your parasympathetic nervous system to take over. It slows the heart rate down. It is the only way to switch off the panic button. So, let's review your survival checklist. I want you to memorize it, visualize it. Scenario: you are alone. You feel the pressure, the nausea, the doom. 1. Call 911 immediately. Speakerphone on the floor. 2. Unlock the front door. 3. Find the aspirin. Chew, crush, and absorb 325 milligrams. No water. 4. Sit in the W position. Knees up, back supported. 5. Breathe. 4 seconds in, 4 seconds out. You are not helpless. You are your own first responder. The ambulance is the rescue team, but you are the one who keeps the engine running until they arrive. Go to your bedroom today. Put a bottle of aspirin and a charged phone on your nightstand. Make it your life insurance kit. I hope you never have to use this protocol, but if that dark moment comes, do not hesitate. Do not worry about being wrong. Worry about being late. Stay prepared, stay calm, and I will see you in the next video.